Today, a prescription for body, soul, and spirit. Dr. Grant Mullen is a medical doctor and anesthesiologist who transitioned into the mental health field after seeing so many of his GP patients struggling with emotional pain. Discovering that there was so much misunderstanding about psychiatry and mental health, Dr. Mullen was driven to educate people, including Christians. His popular title, Emotionally Free, shares this holistic approach: get rid of our emotional baggage, find spiritual peace, and take medications when necessary. Dr. Mullen and his wife, Kathy, speak at seminars around the world and help countless patients one-on-one each year. Please help me welcome Dr. Grant Mullen. Hey, Doctor, welcome back. It's great to have you.
Nice to be back, Leon.
We have been having a lot of fun on these programs.
Or getting everyone fixed.
Getting everybody fixed, but not making it so intense that it's just, you know, we understand how serious it is, you know.
Well, when I teach seminars, I do it all with cartoons.
Do you really?
Yeah.
I like your sense of humor, because otherwise it could be a pretty morbid topic.
Well, you don't want someone to come to a depression seminar and feel down about it.
That is so true. You wrote this book, Emotionally Free, actually a long time ago.
Mm-hmm. Yeah. This is actually its third. It used to be called Why Do I Feel So Down When My Faith Should Lift Me Up? And then it went through Emotionally Free 1 and second. Like, it's been going on for a while.
Yeah. And you've added to, if they've got an older edition, you added a bunch of stuff.
Yeah, I added several more chapters to the blue edition compared to the yellow one.
So you're still learning.
Oh, yeah.
You know, in the other programs, we've spent time looking at your testimony and how God got you to where you are as a doctor and anesthesiologist, and today we kind of want to just start talking about signs and symptoms. Is that what you'd call it?
Yes.
Because a sign is something that can be seen, a symptom is something they've got to be talking about.
Mm-hmm. Or now, how do you make the diagnosis?
Or how do you make the diagnosis? Because you're looking, and would you go through a quick review on, you see it as three areas coming together. Tell me about that.
Yeah, because the Bible says that we are body, soul, and spirit. And so I interpret that as physical, spiritual, and emotional. Okay? And so we can have malfunctions in any of those three parts that will affect how we think, feel, and relate to others, ourselves, and God. And so if we're struggling, because that's just sort of the broad term I use, and someone says, I know there's something wrong, but I don't know what it is, I call that struggle. If you're struggling with your thinking, if you're struggling with your relationships, if you're struggling spiritually, then I say, check yourself out for any problems in these three areas, because most struggles originate in any of these three areas. So the body, soul, and spirit. So there are physical issues like mental health problems. So mental health disorders like mood disorders, they are physical illnesses with physical treatments. Those are medical conditions that affect how you think, feel, and relate. Okay? But there are spiritual issues. So the harassment of Satan, he wants to fill your mind with his thoughts so you think what he wants you to think, and that will affect how you think, feel, and relate. And then your personal past, your emotional baggage, or in other words, your personal history, how you were raised, the environment, what you experienced throughout your lifetime, that affects how you think, feel, and relate, your self-image, self-confidence, self-esteem. And so if you have a problem in any of those three areas, that will affect this, contribute to this sense of struggle. And so in the book, and when I teach seminars, is we walk through how do you assess yourself in those three areas. So I always start with the medical side, because if you can't control your thoughts, you're not going to make much progress on the other two.
No.
Whereas some people go at it the opposite way, and the results are not nearly as good as if you address the medical first. So in my clinic, when someone would come in to see me, the first question I would ask them after the preliminaries is, can you shut your mind off? That is the most useful question as a pastor, as a counselor, as just as a member of the public. If you're trying to help someone who's struggling with their mood, that's what you can ask them. Can you shut your mind off? And if they say, no, I can't shut my mind off, I haven't for years, then that's the tip-off that this probably is physical, if it's gone on for a long period of time.
So is it because they can't shut their mind off from all these happy, wonderful thoughts?
That's very uncommon.
Okay, so these are negative.
Well, actually, one guy in my entire career, one guy came in and said, I'm feeling too good, there must be something wrong. Once, in 25 years.
25 years. So basically, because we were talking about this in another show, that if you can't shut your mind off and it's negative and you're fixated on the negative and problems, because everyone's life has good things and problems. When you fixate on the negative.
Yeah. So when I'm looking for depression, so a person with depression can't shut their mind off, and the thoughts they can't shut off are persistingly down, sad, negative, worried.
Yeah.
And they just can't shake it. And many of them will say, you know, I'm a Christian, my life actually is not that bad. I don't even know why I can't shake this. Or others will say, yes, I'm feeling this way because 25 years ago or some time ago, this happened. Like some trauma. But what the key thing is they can't shut it off. Now in anxiety disorder, they can't shut their mind off, but the thoughts are primarily anxious or phobic or panic. So it's more of a worry theme. But most anxiety and depression, they overlap. Most anxious people have some depression thoughts. Most depressed people have anxious thoughts.
So it's not a clear line.
No, it's not a clear line. But what is clear is it's negative.
It's negative.
Yeah. So what I'm looking for is negative thinking they can't shut off. Now some people say, well, I don't want to kill myself, so I'm not depressed. Well, that's irrelevant. Okay. as long as it's negative and you can't stop it, it qualifies. And some people say, well, you know, I know that depressed people can't sleep, and I sleep all the time. Well, a lot of depressed people sleep all the time. It's an escape mechanism. So what they all have in common is I can't shut off negative thinking. Okay? So depression and anxiety, actually depression and anxiety are two sides of the same coin. Right. It's the same chemical imbalance that causes both conditions. And the treatment medically is in fact the same for both conditions.
Then why differentiate?
Because in counseling it makes a difference.
In counseling?
Yeah, so if you're counseling someone, the counseling path for anxiety is different from depression, slightly. But medically, they're both caused by the same serotonin deficiency. So antidepressants, not tranquilizers, antidepressants can correct the serotonin level, restore thought control so that the persisting negative anxious thoughts stop.
So if you were going to counsel or talk with someone through some real issues, you would first get that mind to stop.
Yeah, so I encourage counselors and pastors who are doing one-to-one ministry, if you see someone who's really struggling, or they're not responding to a counseling program that you know often does work and they're just stuck, you say, well, can you shut your mind off? Or I tell people, pull up the checklist of symptoms in my book or on my website and walk them through it, because if they have those symptoms, then you need a doctor involved more than just the talk treatment.
What are some of those symptoms?
The symptoms I just mentioned. Can't shut your mind off.
Right.
Persisting negative thought. Now, I mean, there's all kinds of other things like, you know, you worry about things you don't need to worry about. There's lots of little specifics, but those are the main ones.
Is it illogical worrying?
Well, most anxious people will say, I really shouldn't be worrying about this. I know it's crazy, but I can't shut it off.
Okay.
Other people will say, yes, I should be worried about this because of what happened in the past, and I'm preoccupied with it. They will justify it. But the only thing that matters is they can't shut it off, and it's interfering with their life.
Right.
Now, in bipolar disorder, it's different. It's a different kind of chemical imbalance. It's not actually a serotonin deficiency, it's some other kind of deficiency. But what happens in bipolar disorder is they will have down times with symptoms identical to what I just described, depressed, anxious. But occasionally, their mood will elevate and they will feel driven. So they won't be able to shut their mind off. So that's what they have in common. Can't shut it off. But the thoughts that makes them feel very pumped, driven, energized, can't slow down. Now, they don't have to be happy, they just can't slow down. So it's the opposite of depression, because depression saps your energy, you don't want to get off the couch. In bipolar or in mania, you're just driven and you can't slow down. Talk fast, move fast, restless, can't concentrate, can't sit still, talking all the time.
Is that also like thoughts of grandeur, that you're all that?
Well, if it accelerates. Yes, so if it accelerates, the worse it gets, then yes, then you feel you have superpowers and then you run around naked. I mean, that would be the psychotic when you lose touch with reality. But in most people who have what we call hypomania, which means just a little bit, they're just driven and they can't slow down.
Describe mania. What do you mean by mania?
Mania is what you just described. I think I'm God, I think I'm Jesus, I have a message from heaven, I can't slow down, I can jump off roofs, lose touch with reality because you're so pumped.
Okay.
That mania is when you lose touch with reality.
Is bipolar, I'm hearing that word a lot more.
It's very common.
Really?
Yeah, at least 15% of all depressed people have bipolar depression. 15%. That's a huge number.
When you look at bipolar, do you just see it as a deficiency, mainly?
Oh yeah, it's a chemical imbalance, just like the others.
Okay.
It's just the treatment's slightly different. You use mood stabilizers more than antidepressants. But here's the catch with bipolar. On average, there's a 10-year it takes 10 years on average for a bipolar person to get diagnosed correctly. And here's the reason, because we can stop that today. Everyone watching this program, that 10 years can be compressed to like 5 minutes, okay? And here's the reason. When people start having bipolar symptoms, they only complain to their doctor about the downs. See, they don't, only once in my entire career did someone come to me complaining about the ups, because when they're pumped and driven, they love it. Like well, not the mania, because then they've lost touch with reality, but the average, the most bipolars, when they go up, they are so exhilarated, they just love it. They're so productive, they're so creative, they're so funny, you know, they're great entertainers, they love the microphone, and so they don't complain about that. But then what goes up must come down.
Right.
And so then when they crash, then they go to see the doctor, and they only complain about their depression, anxiety symptoms, and so they're given the wrong treatment. And they're often given an antidepressant, which could accelerate the swings. And so what I teach people in my seminars is when you go to see the doctor, you need to complain accurately. Because if you tell them the wrong thing, they have no test. Remember, he's based totally on your description. You'll get the wrong treatment if you don't describe your symptoms accurately.
I've often told the people in our church that are complaining about to go with their spouse.
Yes.
Because the spouse sees things and will admit things often and say, okay, well, that's how they see it, but here's how would you agree with that?
In fact, I'm even more firm about that. I actually had a rule in my office, I wouldn't see men alone. I didn't believe anything they told me.
Because your wives are more accurate?
Yeah, the man would say, I'm fine. I don't know why I'm here. It's her fault.
Men are like that all the time.
And so I would just always have the woman there. I'd say, how are you? Fine. How is he really? And then I spend the whole interview with her, and I take this medicine, and I come back in a month. How are you? Fine. How is he really? So
women are brilliant. I don't know why it's like that.
Well, they are really tuned in to feelings, and they just have insight.
They are.
They have more insight than we have. And so you're right. Going with a spouse makes all the difference in mental health because there's no test. And so we really encourage that. Here's another tip, is when I'm treating people with mood disorders, I get them off caffeine. Caffeine is a stimulant.
Please don't say that.
Caffeine,
no.
well, just for people with mood disorders.
Okay.
So, because caffeine speeds everything up. So it speeds up your heart rate, speeds up your blood pressure, okay, it speeds everything up. And if you have a mood disorder and can't shut your mind off, it speeds up your thoughts. So it aggravates whatever it is you're thinking about. So if you're down and anxious, it'll speed up those thoughts. So it increases the depression, anxious thoughts. But if you're on the high, it makes you more pumped and more driven.
It's that serious.
Yeah. And so I learned this from a patient. A patient taught me this. He said, whenever I have caffeine, my mood's all over the place and my pills don't work. And so I said, well, then let's get everybody off caffeine. And so I got everyone in my practice off caffeine, and the pills worked better at lower doses.
Okay, we're going to take a break right here, and I want to pick up right here. We'll be right back with Dr. Grant Mullen.
It takes 10 years on average to diagnose a bipolar person because they don't tell anyone about the highs because they consider that their normal episode.
We believe Jesus Christ came to give every person on this planet a chance to live with power, passion, and purpose. Through award-winning, world-class TV programs like this and life-giving resources in Spanish, French, Italian, Russian, and Hindi, Spirit Contemporary is changing lives around the world. Considerable expenses are involved, but each person reached is absolutely worth the cost. People are saved, their faith revived, eternities transformed, all because of your support. With your donation today, you will receive today's special resource.
With Leon Fontaine. Follow him on Facebook, Twitter, Instagram, and YouTube. With instant access through any mobile device, you can stay up to date with the latest news, comment on your favorite episodes, and watch insider sneak peeks. Bonus videos, inspirational posts, and practical teaching are just clicks away. Spirit Contemporary, social media. Get social with Leon Fontaine.
Welcome back. My guest today is Dr. Grant Mullen, if you're just joining us, and we're talking from this book, Emotionally Free. Now, all right, so I still have some more questions about bipolar because I've been running into it more and more than I ever have before. When I meet somebody now in the hallways, at church, and they gush, but a little bit more than just a person who's happy. You know, I'm almost always automatically thinking that now.
Yeah, I do all the time.
Okay, so I'm not off on that. Like I'll meet someone who goes, this is fantastic and it's amazing. I know I can be, and I'm going, okay, there's going to be a downside to this. I don't want to be around to see. Because they're just a little bit too high. And and I mean, if you're dating someone like that, you need to recognize that as well.
Oh, absolutely. Because I mean, I can spot it. Because I mean, that's that's my business.
It's your business.
But you're absolutely right. And so with bipolars, when they go up, they can be very, very spiritual, and they can be very creative. Oh yeah, because it enhances everything. So whatever's important to you gets more. I mean, if you're into sports, you go sports crazy, and you want to do things all night long because you don't get tired. So on the high, you don't get tired because you're so driven. And so one of the symptoms we look for in bipolar is you can't slow down. You either can't sleep or don't need to sleep. You just keep going all night. And amongst Christians, I mean, because most of my practice is Christians, they would get hyper-spiritual.
Well, we've had situations where, I mean, they'll go, the spouse with this situation will go make investments, purchases, handle money when they're on this high, and almost destroy them within a day or two.
Oh yeah, impulsivity. Impulsivity accelerates when your mind's racing. You'll say, I wanted to have to buy it right now, regardless of the cost.
Yeah.
But it's also true spiritually. So I've seen, because I attracted a Christian population, I saw people get very hyper-spiritual, and then they start to think that they're hearing from God, and then they would run with whatever, I think God just told me to, and they can get themselves into terrible trouble. And so it's a very big problem. And at that point, they don't want to go for help. And so that's why I have to wait for the crash to come, and then they're more willing to go because they don't like the lows. And so I tell people, if you're going to see the doctor about depression or anxiety, make sure you've done the checklist of symptoms. Check yourself out. Are you having times of drivenness, impulsivity, racing mind, can't slow down? Because if you have that, you've got to tell your doctor, so then you get on a stabilizer, not the wrong treatment. And so you see it takes 10 years on average to diagnose a bipolar person because they don't tell anyone about the highs because they consider that their normal episode.
So they're being literally misdiagnosed then, because they're not sharing their symptoms, and then it's getting worse.
Absolutely, because they don't realize that their highs are abnormal. They think that's their normal, so they never complain about it. Doctor never knows about it, and then 10 years go by with all the wrong treatment. They get worse and worse and worse until finally they end up in my office, and I say, do you swing? Oh yeah. I said, did you ever tell anyone? No one ever asked. So I said, we can fix that.
Take your mom or your spouse with you.
But also know what to look for.
Yeah.
So for all the people watching who struggle with depression or anxiety and they're wondering, should I see a doctor? Or if they're on medicines that aren't working, in my experience, the #1 reason why antidepressants weren't working was because they're bipolar and they didn't tell anybody. And they're on the wrong treatment. And so I just say, and they can assess themselves right this minute, or go to my website and go to the checklist for mood swings, and do I have episodes of drivenness where my mind is racing, I can't slow down, and I'm just go, 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 go. Because if you have that, tell your doctor and change your treatment.
What is schizophrenia? I'm going to change subject here. What is schizophrenia?
Schizophrenia is not split personality. Okay, that's the first thing. Okay.
Yes.
Because they
use that as jokes a lot.
It gets under my skin when they say, I'm just feeling schizophrenic about should I take an umbrella or not, okay? Schizophrenic, if it's going to rain. I hear that all the time, okay? Schizophrenia, the root word means two people, but that has nothing to do with this disorder at all, okay? Schizophrenia is a chemical imbalance in a different part of the brain. Instead of the mood control center, which is where the mood disorder problem is, it's in the orientation control center, so that you lose orientation. So in schizophrenia, you can't tell what's real, what's imaginary, what's a dream, what's really happening. So that's why you hallucinate, hear voices, see things that no one else can see. and because you've lost orientation. So
So you can live in a non-reality,
Yes.
in your own world?
Yeah, think you're being watched or followed, visited by aliens. They see people that aren't there. They hear voices that aren't there. And they commonly, in our culture, they have a Christian spiritual theme. And
Really?
Yeah. And so the psychiatric wards, because people have said, how come on the psychiatric wards the people who are hallucinating are all having Christian hallucinations? Is there something wrong with Christianity? And the explanation is really simple, that if you're having an experience that you can't explain that seems kind of supernatural, if you're hearing voices saying that seems kind of supernatural, and you come from a Christian culture, you'll assume it has something to do with Christian spirituality. But in other cultures that are not Christian, they'll assign these experiences to something non-Christian.
Gotcha.
It's just your cultural background will frame how you try to make sense out of something that is so weird.
It's your interpretation.
Yeah. And so if you're a Christian and weird things are happening in the invisible realm, you're going to interpret it in a Christian kind of way, not I have an illness. Okay?
Wow.
So that's why as Christians in the helping professions, you will hear people have weird Christian, or what they call Christian experiences, but in fact they're drifting into psychosis. Psychosis just means you lose touch with reality.
See, I was talking to a doctor of a federal mental institution one time, and he was so against Christianity. He was just almost angry if he found out you were a Christian. And we were talking simply because his words were 3/4 of everybody in here is all dealing with Christian guilt, condemnation, shame, and he just kind of wrapped it all up.
Well, and that's the reason. It's because they're mentally ill,
Yeah.
but because they come from a Christian culture, they wrap it in a Christian explanation.
Okay, so schizophrenia, you're finding success with them as well once you
Not
get...
as much. Schizophrenia is much more difficult to treat.
Okay.
So yes, it is a chemical imbalance, and yes, there are medicines for it, but the results aren't nearly as good as with the mood disorders.
Is that right?
Yeah, it's.
Why do you think that is?
Well, it's a different kind of chemical imbalance, and the medicines don't work as well as with the mood disorder. With a mood disorder, you can return to absolute normal function most of the time.
Yeah.
But with schizophrenia, it's unusual to return completely to normal.
So with schizophrenia, you would more think this is chemical than you would think it's harassment, or you would think that it's inner healing, or you'd still see it all three.
With schizophrenia, well, there can be harassment with anything.
Of course.
Okay, so harassment is just sort of a given.
Yeah.
But it's harder to do inner healing with schizophrenia because it's harder for them to control their mind.
Is it real or is it just made up?
Yeah, and just that they're a little disoriented. But
Okay.
not to say that you shouldn't try.
No.
I mean, of course, because God does miracles all the time.
That's the other factor with
and
all
so,
this.
I mean, I've seen people healed. Even when I prayed for them, I've seen people healed. And so, I'm a doctor. I do the pill side. I see lots of people cured with pills, but I've seen people healed when I pray for them. So I pray for everybody now. Like, to me, pray for everything. But just that there's schizophrenia, counseling is a little more awkward. It's not as easy.
Not as easy.
But we should still do it.
Absolutely. Well, we're coming to a close. What kind of thoughts would you like to share, just to kind of wrap this up? Because this has been excellent. The programs we've been doing, helping get an overall look at this, I think is really setting people free and giving them a direction to go. So how would you like to wrap it up today?
Well, my concern is that these problems are so common. 15% of the population has a mood disorder, 80% are undiagnosed, untreated, and they're in every congregation. 15% of every congregation has a mood disorder, 80% untreated. And then if you add what percentage of your congregation is struggling with emotional baggage, we're at 100%.
Yeah.
So what we're talking about in these programs affects every single person watching, every single person in our churches. So don't you think we should start talking about it?
So so now we're talking to pastors and to Christians. So let's start talking about it. That's basically it. Get a hold of this book, go through it. For the pastors that are here, begin to share that. Begin to add that somewhere in your teaching.
Because people are struggling in the pew and they don't know what to do about it. And if no one ever talks about it, they just stay struggling or ashamed that they're struggling.
Well, in Luke 4:18, where Jesus talks about why he came, one of the things he says is to heal the brokenhearted. I think that would encompass
and set the captives free.
You're so right. And set the captives free. So he very definitely wants to touch this and heal this and help us to walk free in it.
Yeah, and Satan doesn't want us to talk about it so people stay bound and in the captivity of their minds.
So true. Thank you for being with us.
You're welcome.
I'll be right back.
Devoted, a daily devotional created with you in mind. Easy to read and simple to understand. These 2-minute faith boosters are available in 8 different languages. Watch it on YouTube or have the booklet sent directly to your home. You can also receive Devoted to your email inbox daily. Become inspired as Leon Fontaine shares practical biblical teaching. Devoted is literally at your fingertips. Transform your life with this Spirit Contemporary devotional. Sign up to receive Devoted today.
I'm so glad that you joined us for the program today. What an important topic, emotionally free. We live in a world where emotional things are growing at an exponential rate. It's like every one of us knows somebody struggling with depression, struggling with anxiety disorders, who needs to hear about Jesus and to receive the freedom. You know, this ministry is not only going across your nation, but it's going around the world. And it's crucial for us to better saturate it, get into more cities, into more towns. Your giving can make that possible. And as we don't want to wait for years down the road, there are people that are dying. They're going to eternity without Christ. There are those who are giving up on Jesus or who don't even know Jesus who need to hear about Him. For your gift of $45 or more, I want to send you this incredible book you've been hearing about called Emotionally Free. It is a prescription for healing body, soul, and spirit. Your gift of $45 or more is going to touch someone's life for eternity. There's an urgency to get this message out. So go to your phones, don't delay. Become a part of how God is touching people in these last days. And I'd love to send you this gift as a thank you.
We trust that you are being blessed, uplifted, and encouraged in your Christian walk through today's program. As a viewer, you should know that we care about you, we value you greatly, and appreciate your prayers. Did you know that Spirit Contemporary International is taking the good news of Jesus Christ around the world through award-winning programs like this? We are actively translating ministry programs into languages like Spanish, French, Italian, and even Russian. We even air on Islamic television stations in the Middle East. This means that millions upon millions of people are hearing about Jesus Christ in their language, and it's all thanks to people like you. Considerable expenses are involved, so we need your support because each person who gives their life to Jesus is absolutely worth the cost. Each is of infinite value to God. You are very important to us. We care greatly about your spiritual growth, which is why we would like to get today's resources into your hands. When you support this program by making a donation, you are not only enriching your walk with the Lord, you are sharing Jesus with someone on the other side of the globe. Your donation transforms lives by reaching literally millions of people with the gospel. Call now and change someone's life today.
Tomorrow, Dr. Ben Lerner speaks with host Leon Fontaine from his new book, Cancer Killers.
President Nixon in the United States declared the war on cancer in the 70s. All we've done is invest in chemo and radiation. And we haven't looked into other things that could be done to fight cancer.